How many of you go to the doctor's office for an annual wellness check? The key to living a happy life is living a healthy life to experience all the wonderful things that the life has to offer. Did you know that a stroke may occur to anyone regardless of age? According to the American Stroke Association, stroke is the number 5 cause of death and leading cause of disabilities in the United States. By learning more about health conditions, we can learn how to take care of our bodies. There are many health conditions that could cause a negative impact in our lives. It could even reach a point where you will no longer be capable of doing the things that you enjoy doing on a daily basis. The human body is like a car. If you don't keep up with the maintenance, the car will eventually break down. The same way works with our bodies. We must be able to keep constant maintenance to prevent our lives from being impacted from doing the things that we enjoy doing. I have worked in the medical field for over 7 years. Many people only visit the doctor's office when they have a cold or are not feeling well. This is why today I will be giving key information about the importance of our body. First, I will be explaining several health conditions that could impact our lives. Then I will be talking about how the food we ingest affects our health and the importance of exercise. Finally, I will talk about the importance of keeping annual wellness checks and establishing a bond with your provider. Healthcare condition is said to be like a domino effect. When you tip one domino over, the rest is then to follow. Cardiovascular disease is a group of disorders that affects the heart and blood vessels. This can be due to a variety of underlying conditions such as elevated blood pressure, elevated cholesterol, elevated sugar levels. According to the World Health Organization, who wrote the article Cardiovascular Disease in 2021, said an estimated 17.9 million people died from cardiovascular diseases in 2019, representing 32% of all global deaths. Of these deaths, 85% were due to heart attack and strokes. Type 2 diabetes usually occurs later in life, is more common than type 1. This is when our liver is unable to produce enough insulin to bring down the sugar level. Barbara Weiss, a registered nurse with her master's in education, wrote the textbook on medical assisting, 6th edition in 2008, said, diabetics frequently suffer amputations as a result of infections from an injury that would not heal or from the loss of peripheral circulation. This health condition can be detrimental to a person's well-being. It could impede the ability to do physical activities. Depression, a health condition that is characterized more as a mental condition, can also impact your body by the level of stress hormone increasing. It makes it more difficult for your body to fight off infections. If your immune system is low, how could somebody do the activities that they enjoy doing most with these symptoms and constantly being sick? How many people have heard the phrase, we are what we eat? What it sounds like is what it is. Nutrition and exercise have a huge impact on our bodies. In the United States, obesity has become one of the greatest concerns and health problems that we are facing. Obesity means severely overweight. This can be calculated using body mass index. This is a general spectrum because it does not take into consideration other factors such as muscle mass. According to Cheryl D. Fryer and Margaret Carroll, who obtained a master's degree in science and public health, who wrote the article Prevalence of Overweight, Obesity, and Severe Obesity Among Adults Aged 20 and Over, published in 2020, it showed that an estimated 42.5% of U.S. adults aged 20 and over have obesity. For us to take care of our health, we must learn to make healthier choices. There are a lot of healthier options that fit with the wants and needs of an individual. Another health nutrition that we must take into accountability are acquired habits such as smoking and drinking alcohol. Nicotine is an addictive substance that is found in cigarettes. Smoking can impact your daily routine. According to Sylvia Matter, a writer and human biology professor who wrote the textbook Human Biology 17th edition in 2023, said, people who smoke tend to tire easily during physical activity. Long-term effects include many types of cancer, premature aging of the skin, heart disease, aneurysm, bronchitis, emphysema, and stroke. Alcohol consumption is another habit that we acquire that negatively impacts our health. It is said that excessive amounts of alcohol consumption is the cause factor of more than 200 diseases. On the brighter side, exercise can play a positive role on your health and can decrease the risk of a variety of diseases. Exercise can also assist with weight control, improve mood, boost energy, and promotes better sleep. When someone starts exercising, they notice the improvement on their body and their overall health. Did you know that intensive workouts prevent insulin resistance, which is associated with diabetes, and it also has been proven? Remember, your body is like a car and our doctors are like the mechanics. We must keep up with the maintenance to live the life we want without setbacks. Now let's hear from a doctor's perspective on why they are important. Annual wellness checks and establishing relationship with the provider is not just a reason to go to the doctors. It is a good way to see the doctor and ask questions about your health and your body. The physician will then be able to provide you key elements that could be crucial to your health. According to Dr. Carol DeFilippo, Assistant Medical Director and Internist at Caremount Medical, who published the video, What is an Annual Visit in 2019, said, the annual visit is a one-on-one discussion with your healthcare team to assess your current health condition and focus on maintaining good health practice to help prevent future trips to the doctor's office. Annual wellness checkups is to make sure that our bodies are functioning how they are supposed to be. Wellness checkups could catch an early disease that could possibly even be reversible. Working in the Cancer Institute, I have seen a lot of patients who didn't take their health seriously. When they come in to see the oncologist, a lot of them waited until their symptoms have worsened. Again, why let it wait to get to that stage? Now that we know the importance of a wellness visit, how can we prepare prior to seeing the physician? According to Chester Hospital, who published the article 7 Questions to Ask Your PCP at your annual wellness visit in 2023, said, here are 7 questions to ask your primary care physician at your wellness visit. What test or vaccination do I need? How do I get the results of tests or screening? I've been experiencing blank. What can I do to improve that? What can I do to improve my overall health condition or specific condition? Are there any changes I should make to the medication I'm currently taking? How my family medical history affect my health risk or for certain conditions? When should I make my next follow-up appointment? These are all key questions you can learn so much from the doctor's perspective. Now, although it is great to continue seeing a provider about your health, another key component is making sure that you have a good relationship with your provider. Everyone should have the safety and confidence of telling the provider anything, even if it sounds embarrassing. The best way to build a bond with your provider is best explained by Dr. F. Perry Wilson, a Yale neurologist who did an interview on ABC News called Physicians Weigh In on How Patients and Doctors Can Improve Their Trust in 2023, said, a relationship comes from both sides. Patients, they need to start to realize that a lot of the things they're seeing online on social media aren't real. Real change takes work. And so patients have to move a little bit to understand that we're going to ask some tough things of you, real life changes, if you want to get healthy. If you don't feel the safety, attention, confidence, and care that you require, then we should not hesitate to look elsewhere until we find the right doctor that you feel comfortable with. This is the best way to keep a healthy life and having a provider that you fully trust. Now that we all have some basic information on our bodies, we can help many more people understand the significance of our health. First, I explained several health conditions that could impact our lives. Then I discussed what we ingest affects our health and the importance of exercise. Finally, I spoke about the importance of keeping an annual wellness check and establishing a bond with your physician. According to Howard Thurman, an American writer and philosopher who wrote the book Deep in the Hunger, said, do not be silent. There is no limit to the power that may be released through you. With this information, you can do the same thing I did by spreading the knowledge. You can impact your family's well-being and your friends' well-being, just as I hope I impacted yours. Thank you.